shorter article today than our usual ones, but it'll be a good one just to have a bit of a discussion. Jump in whenever you've got something to say, and we'll get stuck into it. So the title of the topic is to flex or not to flex. Is there a relationship between lumbar spine flexion during lifting and low back pain? And it's a systematic review with meta-analysis. So if I just move this around. So low back pain is the leading cause of disability globally and has a much larger issue in low and middle income countries in particular. And with back pain being a worldwide issue, it is also an issue for workplace health and safety. Very often, to prevent or reduce the workplace injuries to the lower back, proper lifting techniques are advised by healthcare providers and workplace safety personnel. The purpose of this review was to evaluate whether lumbar spine flexion during lifting is a risk factor for low back pain, onset or persistence, or a differentiator of people with and without low back pain. So any early thoughts with lifting with correct technique and low back pain?
So I'd like to take charge here. So Laura, I'll grab you first. When we graduated uni, what were you taught about flexion and low back pain and its correlation?
We're taught that it's bad to flex. If you lift with a flexed spine, you're going to do a disc injury. You need to keep your back straight. Bend your knees is essentially everything we're taught.
Yeah, that was exactly what I was taught at uni. And we now have 2 uni students in the room. So Emily or Tom, what uni are you guys from, by the way?
Latrobe.
Latrobe, oh nice. What have they been teaching at Latrobe about low back pain and flexion and extension and lifting? Emily, do you want to go first just to make it easier?
Yeah, sure. Well, they did mention at uni that obviously education is a really important part of treatment as a physio, and as such, like if someone's got low back pain, it's probably a good idea to educate them on proper like lifting techniques. So keeping the back straight and using the legs and all that kind of thing. So yeah, that's as far as I know about.
So no specificity around flexion and its movement towards being negative then, I gather?
No, it sounds like the same as what we were taught.
Yeah, it's about to say, yeah. Doesn't sound like much has changed. Tom, do you have anything to add, mate?
I think we've gone through a few articles by PRSI, and they sort of mentioned that, like sort of what we're going through here, but then we still go back to the principles of like, as Laura said, avoiding flexion. We have sort of discussed topics like this, but it still goes back to that. Yeah, lifting with your left, not being a spine out.
Yeah.
That's it.
Yeah, cool. Sorry, my internet just... Apologies, guys. My internet just... I just missed the last part you said. Sorry, mate. Yeah, my internet just froze at the last minute. Is everyone back? All right, cool. No, I think I caught the back in what you said. I think we're all back. We're just free. Just pause it there, I think.
And I mean, if you can't change the load, then change your principles about movement and keep a load closer to your body. It's just the usual stuff.
Yeah, no, absolutely. Keeping it simple. I like it. Cool. Jack, did you have anything to finish with before we move on?
Yeah, sorry guys, I was just having a fight with the Wi-Fi there. I can only imagine that you guys, I couldn't hear anything you guys were saying, but I can only imagine you were saying similar sort of stuff to what Avi just said, and just sort of encouraging, different movements and encouraging, not so much lifting with a perfect technique, but just sort of improving your, ability to move in different ways is the key.
Yeah, cool. Well, let's get into and see what the journal says. Cool. Take it through.
Yeah. So I won't bore you with all the methods, but they had a look at a bunch of different sort of databases and use a whole bunch of protocols. But going straight into the results, they used 13 papers with 12 independent studies and a total of 697 participants met the inclusion criteria for the review. The overall quality of the body evidence in the review was rated as low based on the grade criteria with a high risk of bias. The review found that there was low quality evidence of no longitudinal relationship between greater lumbar spine flexion during lifting and low back pain on onset or persistence. So I did hear saying at the end there, there's no sort of clear evidence that lifting with a poor technique can lead to low back pain or those disc injuries that we were sort of taught at uni-ish. Going on just straight into the limitations. So there was the 12 studies met the inclusion criteria, and they were overall low quality with high risk of bias. They only used English papers, which may result in a language bias. And all the studies were completed in a lab setting. Movement during lifting in an uncontrolled environment or with heavier loads may result in different outcomes. And the review only considered lumbar position and not the load on the spine. So there's a couple of limitations there.
So can I ask with the limitations, Wazim, can I ask you first, mate, was there any of those limitations jump out at you that might have affected the results of the studies, or anything you'd like to discuss, mate?
I think, but it doesn't say it here, but one of the big things I noticed from this study is that they're talking about like workplace or proper lifting techniques for workplace safety. But this, like all of the studies actually only got people to lift 12 kilos, which is pretty low. So I don't know how much you can take out of these results, because obviously 12 kilos is not much, but during the day, people are lifting a lot more than 12 kilos. So in terms of the results, I don't know how transferable it is to day-to-day people in the gym. You can't really sort of use these results to say, okay, lifting with a bent spine. Like, what if you're lifting 100 kilos in a squat? Does that mean that you could flex your spine? Technique doesn't matter. I don't necessarily agree with that. Like, even though flexing the spine doesn't seem to be dangerous, but maybe with load it could be. So yeah, I think using these results needs to be taken with a grain of salt. Like, obviously, patients that it's not dangerous to bend your spine, but does that mean that we throw out proper technique? Or like, if I'm lifting 50 kilos, I'm probably going to use my legs to lift it up. It's probably just easier, and it's probably the most logical thing. I'm not going to like say, oh, it doesn't matter if I flex my spine and just use my whole spine to lift something that's like 50 kilos. Probably a lot harder to anyway. So yeah, I think that's a big thing that doesn't come up on here, but it is in the actual article. It's 12 kilos. So that's probably the biggest thing.
Yeah, thanks, Wazim. That's a huge point, isn't it? Does anyone else have anything to add to that transferability, just in terms of the weight? I'll pick on you. One of the students want to jump in and have any thoughts around just what Wazim said? Emily or Tom, talk away.
No.
I think Laura. Yeah, please.
Not even so much in the load, but the studies are in a lab setting. So,
yep.
There was didn't talk about even if there was repetition of lifting, if it was just one lift, what kind of environments, was it a functional environment? Like, it was a very controlled setting. So, yeah, it's a number of.
Yeah, no, I love it, Laura. It's such a good point. Like, how can you work transferability if it's in a lab and so controlled in that way? Can you suggest how they could have done it a little bit more to make it a bit more clinically applicable, just off the top of your head, or what you would like to have seen? And then you'd be like, okay, this is actually something I can refer to when working with clients, just out of interest.
Probably like I don't really know how they got study how they each got their sample of people, but probably would have been smarter going out into a workplace, like a warehouse or something, with the same kind of measurements, whether it was like videoing them or getting them to have the markers on their back and that kind of stuff, but actually out in a workplace rather than in a lab, so that you could kind of correlate it, because they're talking a lot about this is what people are taught in occupational health and safety anyway, so a more specific environment would be better.
I think that I couldn't agree with you more. I think the environment is so important, and to the students out there, just this is where you need to look at how studies are applicable to real life patients, because when things are in more controlled environments, as Laura said, its applicability can be very different depending on the circumstances. I can just remember when I hurt my back, and I actually was on a little workers' comp claim as a bloody 17-year-old, which was annoying, and hurt myself. I think I was going to get a 2-kilo battery from a golf charger and hurt my back. But the testing for return to getting there, we just wasn't as functionally applicable. Like to say I could deadlift 12 kilos or lift 12 kilos in a lab just wasn't going to replicate what I needed to do for that job. So I think that's really, really important consideration when you're deciding what to do with certain movements. That's cool. Avi, do you have anything to add with that?
I think that was pretty much covered most of it. I think like all the studies use different loads, so it's kind of hard. I think somewhere it said from like lifting like a pen to lifting 12 kilos, somewhere in there, or I might have made that up. Something like that though, so it's kind of hard to tell. And then I don't know if you looked at the like appraisal sheet that they did, but it said only 58% of the studies had matched the cases with the controls based on the previous exposures that might have influenced their low back pain. So it's kind of hard to tell like what they've been doing before too versus what they're doing in the lab setting. I feel like that's a lot different.
So does everyone understand just what Avi said there? There's no real baseline with the participants, which could definitely play a part with the outcomes of what you're getting. No, I didn't see that appraisal study. Sorry, Avi, but thank you for bringing it to my attention. Bad me. But I think it's really, really important because we want from these little discussions to take away what can we do in clinic tomorrow based on the study we've read. And sometimes these discussions help us work that out. So I think, like you said, what Emma said before about education, I think is really, really important. So getting that baseline education, seeing where they're at and working towards it's really important clinically for the clinical implication of it. Jack, was there anything else to finish off before we get into more of the clinical implications?
Yeah, just I loved all those comments and just sort of combining what Wazim and Avi sort of said, like, I don't know if there was a baseline of, how much they could lift, the participants could lift at the start before they did the session, before they did the testing. Sorry, so 12 kilos could be, that could be a new lift for them, or that, there could be a gym goer who's deadlifting 60 kilos on the regular, and that 12 kilos is nothing. So it's all about, how much exposure you have to that lift. And whereas my sort of bias is like, there's no one wrong movement that you can do. It's just, have you been exposed to that movement? What's your experience like with those movements compared to, will determine whether you experience pain or not.
Yeah, I love it, mate. All right, let's get to clinical implications.
Yeah, so good body mechanics are touted as a way to prevent and treat low back pain in the workplace, and also very often in physiotherapy clinics. Oftentimes the good body mechanics approach is taken as an effective approach without any questions. This dogma is included in physio training in many countries around the world. While keep your spine straight and lift with your legs is often taken as a surefire way to prevent and treat low back pain. This review suggests that flexion of the spine is not a predisposition to low back pain or injury. Let's move this over. Recommendations to avoid lumbar flexion during lifting may create an increase in fear and a subsequent decrease in physical activity. When 3 national guidelines for managing low back pain were compared, the advice was to offer high quality education, including return to work guidelines and expected course/outcomes for an episode of low back pain. Avoiding flexion of the spine was not included in any of these guidelines. As early as 1999, studies have found that the biomechanical evidence for keeping the back straight is lacking, and yet body mechanics and protecting your back is still part of physiotherapy training and perpetuated online today. The conclusion of this study, in line with the previous studies, is that there is no credible longitudinal or cross-sectional evidence to suggest that a more flexed lumbar spine during lifting is a risk factor for low back pain onset or persistence, or a differentiator of people with and without low back pain. Any sort of implications of those sort of things that jump out at anyone straight away?
Not specifically from there, but in the article they were talking about that the amount of flexion didn't correlate with back pain, but people that had back pain were more likely to lift with a straighter back, so they were less likely to flex. I don't know where I read that in that article, but somewhere. So, which kind of fits with what we were talking about last time with like the motor patterns and guarding because of pain. So people with pain were lifting with a straight back, but was that because they were actually too scared to bend?
Yeah, really cool. So what you're saying there, yeah, Laura, is sometimes that this, those cues might actually be detrimental to people because they won't encourage them to move as efficiently. Is that what am I interpreting that right?
Yeah, pretty much. Yeah.
That's such an interesting concept in itself because, as you know, it was just drilled in us when we were at uni to teach people back straight, core turned on. But I think the more recent evidence suggesting it might actually inhibit them from just moving correctly and accessing all those muscles. Really cool. Thank you for that, Laura. Wazim, do you have anything to add with that? That was just a really interesting concept. I'd love to delve into.
Yeah, I think I don't know. I feel like in terms of studies like this and what is getting pushed at the moment, I feel like it's too far towards the other side saying that it's like okay to lift. However, like body mechanics doesn't matter. It doesn't correlate to pain, but I still feel like what's wrong with good mechanics? But obviously, if we're portraying to the patient, flexion is the devil. But I think we can still use good body mechanics without demonizing flexion with lifting. So I think it's a bit of a balance. So like what Laura said, if people that are in pain are bracing more or they're just not flexing their spine enough, then obviously that's not a good thing. But again, if they're not having good mechanics, movement mechanics generally with lifting, then that might also be a problem. So maybe it's a balance between, it's okay to flex your spine, but it's still good to teach someone how to pick something heavy off the ground or how to use their hamstrings and glutes to pick something up or stuff like that, but not making it like flexion is the devil. So I don't know. I think it's a bit of a balancing act in that sense.
I really like what you say. I think just in physio in general, sometimes we go to extremes too much and don't meet in the middle, as I think we spoke about a bit about last time. We just look at just the gym, right? There are still better ways to move in the gym when you do a squat or a deadlift or any movement. So you're not going to, but at the same time, everyone is individually different. So
that's right. Yeah.
You're still going to look at form to do that. So there still will be more correct ways to go about lifting. I think, like you said, though, the importance is not exacerbating fear of body movements and telling people you must not do that. I was talking, I don't mind sharing, I was talking to a young mum the other day about a client who just said to me, look, when you give my daughter instructions, because she's a bit on the spectrum, like, please remember everything you say, she will interpret literally. So if I was saying, don't bend your back in this way, she would never bend her back in this way. She was actually telling a story for you AFL people out there where she was playing in the back line and the coach told her to never fall off her opponent, and she just never moved. And sometimes there was opportunities to intercepts and marks, but she was just focused on the opponent. She interchanged herself when the opponent came on. So the reason I shared that story is it's so relevant to what you just said, Wazim, because I think we can't go too far the other way as well, and remind ourselves, because there are more efficient ways to move. And I think that's, I think it was a really good summary, and that's something I interpret. So thank you for sharing that. Avi, do you have anything to add?
I feel like it's pretty much covered.
Yeah.
I don't think this was the greatest study.
Yeah.
I think it was kind of low quality. Everything was, all the studies were really different and hard to compare and hard to translate into real life situations. But so I wouldn't necessarily throw out good or whatever we think are good body mechanics, but there's going to be some variation within patients and how they lift things.
Yeah, no, cool, Avi, thanks. Oops, sorry. I just think, I think there's certainly different things, like you said, that are just so important. And when you're looking at low quality studies, I think it's important to acknowledge that, because there's some clear limitations there, as well, which I think is very important to keep in mind. So, thank you for that. That makes a lot of sense. Do the students have anything to jump in? All right, I won't throw you under the bus if you don't. I think it's a bit mean. Am you good? Yep.
Just thinking, back to what Sim was saying, I don't think it's a good idea to sort of demonize anything. People who do have a lot of yellow flags, because I guess obviously more as time goes on and on, they're sort of linking pain more to your psychosocial factors. So if you sort of start drilling it into people that this is the reason why your back hurts, and demonizing that, then obviously they're not going to want to do anything at all. So that's just counterproductive.
Absolutely. And what you'll see when you start to treat people, and you might have already seen this in clinic already, is that you're just going to limit your ability to help them go through that journey, and help them improve them functionally, because they're going to have this predisposition around not doing certain things. So sometimes what you say, as you just said, is much more than what you do. So no, thank you for that, Sheng. I really, really appreciate that. Tom, do you have anything to add, mate?
No, nothing to add here.
Yeah, cool. Cool, straight at you. I think that's really important. So to tie this all together, the clinical implications, I think we can all agree that this probably wasn't the highest quality, studies involved in this. The implications were not as clinically applicable as would have liked. What do we take away from this? How do we go into clinic, and how do we apply this? Is there anything, maybe Laura, you can kick us off. How do you interpret this, and what we should be doing in clinic with our clients straight after this journal club?
A few things. So probably educating on movement, in terms of no movement is bad as such, but when is it appropriate to use particular things? So when is it appropriate to flex your spine, or when do you need to brace more or use your legs, that kind of thing. But also encouraging people to move in all directions. So I don't know how many of you guys have done the DMA Pilates course, but they were all about movement bias, and then slowly bringing in the opposite movement. So like everyone has said, not making one movement, don't do that movement, but educating on safe ways to do that movement and when it's appropriate. The other thing about the study, though, is it just looked at flexion. So what about combined movements? Because we know a lot of disc injuries happen with a bend and twist or whatever. So it doesn't look at rotation, and if that then would change the study. So I think just a lot of education through the clinic.
No, I really like you said there, encouraging movement, I think, is so important. Always say #movement is medicine. And I think a big part of people with lower back pain is we're just so stiff because we spend so much time at computers and not doing much. So movement is so important. But I love what you said about that combined movement, actually, Laura. Do you find, are there any, just from your clinical experience, are there any particular movements that you would avoid people doing with low back pain, or any directional preference? What's your take on those sort of concepts, actually? I'd really love to hear your thoughts.
I think either or, like if you're like flexing and twisting particularly under load, like looking at the mechanics of a disc, we know it's kind of more vulnerable in that like kind of posterolateral corner, if you would say, a corner on a round thing, but you know what I mean? Or even likewise, like an extension with a rotation. It's like those combined movements that can sometimes really aggravate. So if you then have, you know, changes on imaging that you would find in anybody, but, you know, maybe like thickening of the discs or, you know, degeneration around the joints, those combined movements are where oftentimes the aggravation is going to come. And whether that's structural or, again, like guarding from muscle, I don't know, but it's, yeah, important to probably add all of those things, because we get really hung up on like one direction movement, and I don't think a lot of us move across planes or add rotations and that kind of stuff as well. So yeah, I forgot what the question was, but that's my answer.
No, I think you answered it quite well. I was just talking about if you had any biases or if there were any particular movements that you think might be more predisposed to hurting your back. And I haven't really seen it, you know, to be honest. I think my bias has been because I've done a lot of, you guys have heard of Mackenzie extension training, I'm sure. It's definitely a go-to, yes. The students are nodding too. I know Harvey has. So it's something I go back to a lot and sort of just trying to find a movement which can alleviate symptoms and help with movement. So, but I'm trying to find that extension seems to work really well. But yeah, I think don't be limited by that as well, because everyone's individual and different. And if you have that underlying facet of just looking at that person, looking at them at holistic, I think that really helps. I think so, that's what you're alluding to in a different way, Laura, with all those movement patterns. That's awesome. Thank you for sharing that. Anyone else have anything to add about clinical applications? I feel like, Harvey, you have. Hit me up. I love how you tore the paper apart. That was good. But yeah. Just unmute yourself, Harvey, sorry.
Oh, sorry. Can you hear me?
Yeah, we can hear you.
Okay. Well, thanks for making me talk about this again. I feel like everyone covered the main points of this. I think like, I don't think there's any specific motions to avoid unless they're the painful motions for that patient. I mean, yeah, I think combined motions are the most aggravating of what I've seen. And yeah, once again, nobody really moves in just a straight plane. So I think everything I was going to say was already said.
Yeah, cool. No, perfectly summed up.
Yeah.
Wazim, do you have any final thoughts, mate, or any take-home clinical implications?
So I think this study is probably the most relevant, maybe because it's been like low load. Maybe if you know people are using the keep your spine straight and lift with the legs as a preventative in workplaces, maybe that's outdated because it's such a low level. Like obviously teaching them that safe, but maybe it depends on the workplace. Maybe if I don't know, you're in a workplace that maybe there's more load, then you know mechanics might matter then. But if it's like a pen weight or 10 kilos or something like that, maybe it doesn't matter to keep your spine straight. So I don't know, maybe it needs to be tailored as opposed to everyone keep your spine straight. Don't lift with your legs. So yeah, I think like what Jack was saying, it's not like everyone's going to be different. Maybe some person might be in pain already, or another person might have weak glutes, or another person might not be lifting right. It's to give like a blanket approach to every workplace. I know that when I'm treating and I flex my spine, I get sore after a couple of hours. So it depends. I just feel like it depends too much. There's no real right or wrong, but keeping the spine straight is probably is outdated. So maybe we need more educational. Maybe we need more physios to go into workplaces and give them professional talks.
I think you're onto something there, mate. I think for sure. Yeah, nice. Before I go to Jack, do any of the students have anything to add? You don't have to wrap up about a clinical implication from it.
Just a small one is maybe just about, maybe a very fear asking a patient, what their thoughts on. Do they think their back pain is coming from their job where they are constantly flexing? Is that, do they have a belief that that's causing their pain, or getting their thoughts on what the situation is?
Oh, I couldn't agree more. Patient beliefs are so important, and they're also hard to break even if they're incorrect. So that acknowledgement, I think, is super important. We get that all the time. I still get the old patient come in saying how ultrasound has fixed their low back pain, and do we have it? And I'm like, oh, we don't. But that perception is really important. So it's just something to bear in mind, for sure. Thank you, Tom. Em, do you have anything to add? We're good.
No, I'm good. That was a really good point by Tom, actually.
Yeah. Cool. Jack, you want to wrap us up, mate?
Yeah, every good point I was going to make has been taken. So it's been a pretty good summary by all of us, I think.
No, I'm fair. No, I just want to thank everyone for that interpretation. I think it's really important when you look at studies like this, really to unpack them correctly. And it's why I've really been inspired to do these journal clubs, because as you can see, we need to look at literature and interpret it correctly. So that's something I think we haven't been taught very well at uni. I don't know how well they did that at La Trobe, certainly at Sydney Uni. Jack and I will tell you, not very well. Arby's Uni actually pretty good. We've had some fun with some discussion of journal papers when she was here, and that's why we still do it now. So interpreting the clinical implications is so important. And I think we all got different take-home messages from today, but look at the literature and look at how we can apply it. And I think it came back to fundamentals of what we all agree with, which was, really patient-centered education, looking at outdated education in terms of the back being straight and not just falling back to that, and not throwing the baby out with the bathwater, as I love to say, because there are better ways. I know. Are you laughing at me for saying yes, I say that a lot, don't I? It's a very Australian phrase. In terms of, just looking at, there are better, more efficient ways to move, especially with lifting. So, hopefully you've taken a few top takeaways there that we all spoke about, and you can apply them most importantly when you're seeing your clients this afternoon and for the rest of the week. So thank you, everyone. Any final thoughts before we finish up? No? All right. Well, thank you so much. With Zoom, Laura, if there's any articles you want to review. How long are the students here for, by the way?
These ones are here. These ones. Emily and Tom are here for another 3.5 weeks.
Okay.
We've got students right up until Christmas, so.
Yeah. We kind of got in. We